evening, everyone. Tonight I will be talking about CPR while also demonstrating. Now, before I do any type of demonstration, I would like to give a little background of CPR and who were the inventors, and basically in what time era it was invented. Now, CPR was something that started in the 1950s and early 1960s by these two Russian doctors by the name of Dr. Peter Safer and Jan Ellen. Now, these doctors were working in a pediatric hospital, and they realized that after birth a lot of children were choking on the meconium, which is the fluid that's in the belly when they're coming out, and a lot of these children were dying because they weren't able to suction them. They didn't know how to remove this. So they developed a concept where they were doing chest compressions and breathing to help open up the airways and have the child cough, cry, just to open up the lungs. Now, so with that being said, in the end of the 1950s, mouth-to-mouth resuscitation started to dwindle off because people started to think that it wasn't as beneficial as these two doctors said they were. So they completely stopped doing them. Then it reemerged in the early 1960s, back again in Germany, and these two new doctors kind of like reinvented it. And these two doctors were called Dr. I'm sorry if I'm pronouncing it wrong, but just bear with me, Dr. Kuwanhaven and Dr. Knickerbocker. Now these two doctors realized that after intensive studying and really going back and doing types of demonstrations and props and everything else, they realized that the chest compressions and the mouth-to-mouth were the best possible way to help resuscitate anyone that was not conscious or that wasn't breathing and that needed some type of help. Now, CPR is usually started between 2 to 3 minutes when someone is unresponsive. And CPR, basically, what it does is that with the chest compressions, you're manually pumping the chest, which is the heart, causing the blood to go in and out. And what's that doing? It's helping oxygenated blood get into your bloodstream so you can basically rev back up. So after you get some type of a pulse or any type of an EMT or someone emerges on the scene, basically your CPR session is over and you let them come in. Now this evening I will be having Vanetta come up and help me out while demonstrating what CPR is. Now I'm going to also pass around this photo. Now this is a photo of a mouthpiece, and this is basically of the modern world. A lot of healthcare and people that are also passionate about helping others usually carry these in their wallets. You can purchase them, they're like maybe $5, and you keep them, and they're mouthpieces where in case you could be anywhere and you know someone is unresponsive, you can use it and put it on their mouth so you can do mouth-to-mouth. Also, there hasn't been, even though they have these mouthpiece and everything else, you can come along, even though they've invented these mouthpieces, there's never been any type of cases to prove that people are, being catching any type of communicable disease from mouth-to-mouth resuscitation. Okay? So now, Vanetta here is unresponsive, and when you see someone that's unresponsive, the first thing that you do is ask the patient, "Are you okay? Are you okay?" And now if they're unresponsive, if you see anyone around you, you say, "Please call 911. Now, I'm sorry, can I take off your glasses?
Yeah. She's unresponsive.
So, when you remove the glasses without asking for permission, you look and you listen. And looking is to see if the chest is rising. And you listen by putting your ear to the pedestrian's mouth to see if you feel any type of air or any type of slow, shallow breathing. And if you don't indicate any of these two things, then you proceed to tilt the chin back as far as you can to open up the airway. And with doing that, once you do that, you pinch the person's nose. And then you hold up the chin, I want to pinch it to her, and then you proceed to give 2 deep breaths. And you should be able to see the pedestrian's chest rises up. Once you do that, then you come up to the patient's chest and then you make a marker. Well, you can say, well, basically, if someone's belly button you mark it up to the sternum. And then you take your right hand, or whatever your dominant hand is, and then you put the palm of your hand on that patient's chest. And then you apply with the left hand, or whatever other hand is free, and then you continue to go, you proceed to do 30 quick chest compressions. Now, with that being said, you can sit up. With that being said, a lot of people are hesitant, thinking that, oh, what if I break a rib or whatever. It's not, you're trying to save the patient or the person or the pedestrian, whoever that might be. So breaking the rib is really the least of the patient's problems at that time. You just want air to be going into the patient's lungs so the oxygen and the blood can keep flowing so there's no brain damage. And with that, hopefully while you're continuing chest compressions and 2 breaths, it's a continuous cycle until a healthcare provider comes onto the scene, or an EMT, that has a defibrillator, which is the 2, they're like shockers that they use to shock the heart if the patient or the pedestrian is not responding. And this is the end of my demonstration.